As mentioned in part one of my presentation on leprosy, not everything is cast in dark light. There is a glimpse of optimism that pervades the community. The people involved in the care and maintenance of the patients and the grounds have banded together. They understand that they are all sequestered, but they see opportunity. I once interviewed Indian and Bangladeshi expats living and working in Saudi Arabia. They told me that the psychological effects of poverty outweigh the physical barriers associated with economic strife. The subject came up again as I toured the grounds and met with these patients. Achieving a satisfactory state of mental health is a large component of successful recovery. I caught this gentleman as he was about to perform his daily task of personal hygiene. Through an interpreter, he said that this was the very first, and perhaps the last, photograph to be taken of him. I realized more fully the feeling of insignificance that can be experienced at this social level. I also came across people who carried themselves with great dignity. I perceived in them a spirit that would not allow circumstances to defeat them. People worked together as a team. With age advancing, as well as the problems with his hands, this patient was quite candid about his future. He also mentioned how thankful he was to be among his community members. He stood straight up and sucked in his breath while his picture was being taken. He was proud. This attendee said that caring for the patients afforded her the opportunity to practice karma yoga. Serving others is one way to fulfill the Hindu precepts of charity and self-sacrifice. This woman had severe problems with her lower extremities. Despite that, she wished me well and raised her hands in a show of respect and acceptance. This gentleman had trouble getting around and was not in healthy weight. Yet, he welcomed me into his dwelling and offered me some tea. My guide, happy, politely declined on my behalf. This fellow was the noted philosopher of the group. He had been well educated before his time of trouble. Now he was quite pleased to sit and debate issues with his comrades. When I was in Varanasi, I walked down the ghats, the stair steps leading down to water's edge. There, bodies were cremated in front of the sacred river Ganges. This man with advanced leprosy felt that he was in the right place at the right time. To die and be cremated at this site is believed to be a holy blessing. I gave him money in exchange for me taking his photograph. He welcomed the arrangement. Back in Delhi, I spoke with a man and his son. The gentleman had just come out of surgery and was despondent. The grim reality of amputation is hard to reconcile. I traveled a great distance to Bodh Gaya in Bihar state. This is one of the poorest states in India. They have a high percentage of people living in rural conditions. Living in rural conditions, quote unquote, in India really means something. Life is very, very difficult. But these young women have a local clinic sitting on a dirt road leading to their remote village. I walked there and I met the physician who was responsible for care and maintenance of the local, desperately poor villagers. He took the time to teach me about leprosy. He drew diagrams in my journal to emphasize each point he was making. As he spoke, the local women gathered to receive their leprosy medicine and other necessities. One young lady in particular was barely into her teenage years. Her future and that of her newborn were at the mercy of regular testing and other such medical maintenance. The bottom line is that leprosy thrives in part due to lack of education. Secondly, There are ancient cultural myths and misunderstandings that make widespread treatment more difficult. Thirdly, the stigma surrounding leprosy makes it difficult to mitigate the disease out in the open. More money, more study, and more public attention are the engines that would drive the emergence of a widespread cure.